I mean, if we think that premorbid disability is controversial, premorbid dementia in some ways is even more controversial, because in the case of premorbid dementia, you know that the person's coming into their stroke with what in most cases is a progressive neurodegenerative condition like Alzheimer's disease. And unfortunately, in this day and age, we don't have a cure for this disease, and so and it is clearly one that sort of chips away at someone's core. And by the time you describe somebody as having dementia, by definition, they're needing help for several daily activities because of problems with their memory and thinking, right? So you can imagine that if people were feeling any qualms about kind of the risk versus benefit of treating people with pre-morbid disability, then that's a heightened several-fold when they're encountering somebody with pre-morbid dementia. So I empathize completely with my colleagues that struggle with that decision, right? Because at the core of it, the question that people are asking is, are we doing more good than harm when we're treating patients, right? And depending on what healthcare system you're in, there can unfortunately also be several concerns about kind of the judicious use of healthcare resources, right? So the debate came down to this question of, based on the current balance of evidence, what should people be doing when they're seeing these patients? And while we each took sides in the debate, the truth of it all is that at this stage of the game, we don't have high quality evidence of efficacy of thrombectomy in this population, because just like with premorbid disability, people with dementia have been generally excluded from stroke trials. So we don't really know about whether they'd benefit when treated with endovascular thrombectomy or thrombolysis, for that matter, compared to those who aren't. The best evidence that we have would be observational evidence, but even that is fairly sparse. Although we're hoping to chip away at that in the coming years with some analyses that are coming out of the American Heart Association's Get With The Guidelines registry, for example. The point of view that I took in the debate was that at least we don't have evidence of harm. So the little observational evidence that we do have doesn't seem to suggest that when you do thrombectomy in these patients that they're, say, more likely to bleed or more likely to suffer procedural complications. And the procedure seems to, at least technically, be similar as in patients without dementia. The question of whether they're going to benefit when treated with it kind of remains a little bit open.